I'm David and welcome back to another first aid skills video. In this week's video we're going to be going over choking. So choking is any time the airway is obstructed by something. That could be blood, vomit, your throat from swelling, or your tongue. Your throat and your tongue would be anatomical blockage, which we deal with the tongue with a head tilt chin lift during CPR to open up the airway. Or it could be food, toys and children, anything like that, any foreign object, which would be a mechanical obstruction. So there's two different types of choking. There's partial choking and then there's a complete choking, a complete blockage. So with partial choking, what you're looking for in a person is they'll be coughing. So they're still breathing on their own and their body's coughing and trying to push this object out. Now, when we're dealing with someone with a partial blockage, you don't necessarily need to call 911 because their body's still working on getting it out and it might actually get the object out. What we do is just closely monitor them. So stay with the person. Don't let them leave. If they get really uncomfortable and don't want you around and want to leave, let's say they go to the bathroom to go hide somewhere, just kind of follow them to the bathroom outside, listen, wait for them to drop if they become unconscious, and then you can help them at that point because they can't tell you that they don't need help or don't want help anymore. But if they're willing, stay there, encourage them, keep telling them cough, cough, come on, cough. It'll either come out or they'll stop coughing, stop breathing, and that's when it turns into a complete blockage. So with a complete blockage, there won't be any more coughing, no more breathing, there might be some wheezing sounds, which isn't your typical breathing pattern, so it's not normal. And in these cases, we can help somebody. So when someone has a complete blockage, the universal sign for choking is this. They'll probably have their hands around their necks. They'll look panicked, like something's wrong. So I'll have Cheyenne here to show how to do it. So when we're dealing with someone with a complete, you always want their permission still to help. So you want to ask, so you'll be like, hi, I'm David, I'm a first aid trained, do you need help? And they'll most likely nod their head because they want your help. And so once you've gotten that consent from them, there's three things we can do. We can either do chest thrusts, abdominal thrusts, or back blows. And I'll show you how to do each of those. So for back blows, you want to get behind the person. You want to put your foot kind of in between, spread their legs out a bit so they have a more solid stance and you have them in case the object doesn't come out and they drop. You want to lean them forward as far as you can because the more of a downward angle there is, you have gravity helping you. So you could, if you did the back blows from up here, you have to force it up against gravity and out. So if we turn them as far forward as we can, now we can do our back blows and use gravity. So for the back blows, you want to find their shoulder blades or their scapula, and you want to hit right in between that. And you want to go 5 times. So you want to go 1, 2, 3, 4, 5. And when you're doing this, make sure you'll be going quite hard, but try not to glance off and hit them in the back of the head. So you do 5 of those, and then you can alternate. Actually, you can alternate between any of the 3. So you do 5 of one, 5 of the other, and you alternate those and just stick between those 2. Whatever works best. In different scenarios, we'll call for different ones, which I'll explain in a bit. And then you can do abdominals. So same thing, give them a wide base, foot in the middle. You want to find their belly button and go just above it. You want to make a fist with your thumb out of the way, and your thumb is what's going against them like that, and then you cup your hand on this side. So you find the belly button, go right above it, and you want to go in and up a little bit against the diaphragm. So you'll do 5 of those. You'll pull in hard because at this point you want to push this thing out and you only have so many tries. So you want to go in and up. 1, 2, 3, 4, 5. And then the third option, which is good for pregnant women, somebody in a wheelchair, overweight people that you can't reach around on their stomach, would be chest thrusts. So for chest thrusts, you want to go right in the middle of the nipple line, and then you do the same thing. Instead of going up though, you're just coming straight back for chest. So you go 1, 2, 3, 4, 5. So choose 2 of those 3 and alternate those until either the object comes out or they become unconscious. Thank you. And if they become unconscious, this is where we move to CPR, which we'll learn in a couple weeks. Now, if, let's say you're choking alone, there's no one around, you want to find an object that you can do it on yourself. So when you're on your own and you get a complete choke, you want to call 911 right away, and you want to leave the phone unhooked so they can hear what's going on. And the best thing is not to stay in your house and try and do this. It's to go outside or where someone can find you, because if you do drop, because you only have so long while you're choking, someone might actually witness you, and then you're also easier to find when 911 gets there. So I'm going to use a chair, but you can use anything that's rounded, so not super sharp, so you're not impaling yourself on something. So a hood of or a trunk of a car would be good because you're outside and it's a smoother object, or a chair. So you want to get up behind it. You want to line it up with your, or just above your belly button again, same as the abdominal thrust, and you want to just drop yourself on it. And you want to go as hard as you can to try and force that object out. And so for, also with the complete choking, for partial, we didn't call 911. With complete, we do call 911 right away unless we're alone. So if there is a complete chokage, you ask someone to go call 911 and get an AED. But if you're alone, try to deal with it first, because you may actually be able to help it. And if you take time to go call 911 while they're choking, they may drop on you before you can actually start doing care. So that's it for this week's video. Next week we'll go over how to do choking on an infant and child. So I look forward to seeing you all next week. Thanks.